This is the Gum Guru with Dr. Macon Singletary from North Raleigh Periodontics. This is a show about keeping your teeth and gums healthy and how a healthy smile affects your overall health. Today's episode is called, Are You or a Loved One Missing Teeth? Comparing overdentures, implants, and bridges.
Welcome to the Gum Guru podcast with Dr. Macon Singletary. I'm Jason Kong. Thank you so much for joining us. And as you just heard, we're going to be talking about options for those with missing teeth. And Dr. Singletary, this can be something that, of course, people have to deal with, and we may not have fully explored all the options available to us to fix that issue.
Yes, and it can be complicated, but I would like to wish everybody a happy Thanksgiving, and hopefully you'll be able to go through your meal and eat as efficiently as you can. We're getting missing teeth replaced and in a great way. But yes, there are many options available for people to have missing teeth, and beauty's in the eye of the beholder. I always tell patients, it's what you want. It's not necessarily what somebody around you wants. And so you sort of have to assess where you are, why you are at this position with missing teeth, and what can you do.
Yeah, and it can have a tremendous impact. I mean, you just mentioned food. It can keep us from eating some of the foods that we love to enjoy, and we may be afraid to smile, be more self-conscious about our smile, and that has an emotional and a mental impact on people. Definitely,
and that's the key, and everybody's different. So when somebody comes in to see me and they have missing teeth, I assess several things: the medical history, why did they lose their teeth, what would the future tell? And I'm seeing a snapshot of the patient. What the movie picture is going to look like just varies from person to person. Depends on medical history. Some people come in and they want the Taj Mahal. They want all on fours and fixed. The missing teeth, and they want something they don't have to take out at night. And that's a great goal. But the question would be, why did they lose the teeth to begin with? And was it recurrent decay? Was it periodontal disease? Was it medication? But there's always a way to fit a functional, looking good device or replacement for anybody. It's just a matter of what that person wants to tolerate and feel good about. You can do an overdenture if you're completely dentureless. An overdenture means there are a couple of implants in the upper or lower that the denture fits on and gives it retention, and it still comes out at night. There is just plain dentures, which if you got enough bone, that could be done. If you go from dentures to overdentures to, okay, you got some teeth, do you do partials? Now, it's unfortunate this day and age that the partial way of replacing missing teeth is you got some teeth there that you can attach a device to that's not it just replaces 2 or 3 missing teeth. You take it out at night. It's an inexpensive way to go. If you got sound teeth, it's a good way to go, and it doesn't cost as much money. But the key is the foundation to begin with. Are the teeth good? Are they periodontally sound? The third way to go is implants for the missing teeth. If you got 1 or 2 here, replace it with implants or bridges. Then you go from, I'm replacing missing teeth to I want them to look better. And is that something that you want to do necessarily? You may be opening Pandora's box. You're eating okay, they look okay, and somebody says, well, I got a little recession here. What do I do with that? And so trying to help the patient through the options of replacing, looking good, it just varies from person to person. You sort of got to fit their desire with what's, why did they have the problem to begin with?
Speaking of having the problem to begin with, sometimes that could be maybe a little bit embarrassing, and it may be something that psychologically we choose to ignore rather than address it. What happens if we don't address having a missing tooth or missing teeth?
And that's happened a lot recently because of COVID. People are afraid to come in, and then there are people who, like me, when I was growing up, I went to the dentist one time at 8 years of age, and I said, I'm never going to go back. So it's a long story why I went to dental school. But between 8 years of age and 22, when I'm in dental school, there's people have to overcome certain fears. But what happens is that if they don't maintain a good cleaning sequence where somebody's monitoring their gum tissue health, monitoring decay, they can get to be a dental cripple. They can get decay that, I always say if it hurts, it's like high blood pressure and glaucoma. It's too late. You're too far down the road, most likely to bail it out. You don't want to wait till it hurts. So you want somebody to have a good pair of eyes on it, even if it's just to go in and have a cleaning. And then at that point, somebody says, okay, you got this that needs to be done, and it may be sticker shock. It's always good to get a second opinion. There are different ways to treat missing teeth and how to replace them. Some people, this day and age, they take the path of least resistance. And if a tooth looks like it has a lot of decay, or just take it out and do an implant. Well, not necessarily. Or they may have periodontal disease, and they say, well, you got periodontal disease, let's take it out and do implants. Well, you got to be careful on that one, because if you lose a natural tooth due to gum disease, you're going to lose an implant. And so it's good to get knowledge. Ignorance is not bliss. You do want to know what's going on.
Yeah, for sure. And so you mentioned a lot of different options. I mean, we went over dentures, overdentures, implants, partials, bridges. How do we know what's best for the individual?
Well, I start out with a medical history. They will come in, and most of the time I ask them, even though I don't do restorative therapy, I work with general dentists, or I refer out if somebody doesn't have a general dentist. But I ask them, what is your goal? And it may be, I want to fix this one tooth, and there's tons of other things that need to be done. Well, we sort of address that area and then go from there. But you don't want the house to burn up. But and it could be as simple as getting a good cleaning and a filling, or it could be, I want my teeth straight. And I want to look better. I want that space to go away. Michael Strahan has that diastema between his front teeth, and that's his trademark. It doesn't necessarily mean having your teeth straight as a picket fence or pearly white is for you. And so what I do is try to help the patient understand, where they are, what do they want, first of all, what the need is, and then go from there, and then try to get a treatment plan or an option to tell them this is what you should think about. And sometimes they're pretty adamant, know exactly what they want. And then I try to help them from my point of view to say, okay, this would be a good investment. This would look good. And then I'll send a note or an email to the dentist that's doing the work, and we sort of collaborate. If it's a patient that's come in and doesn't have a general dentist, I'll sit down with them and say, where do you live? Where do you want to go? And then I'll try to, get that patient to a person I think will help them with their needs. It may be just a simple filling. It may be a resin. It could be a veneer. And veneers are options, and they're like artificial fingernails. Somebody says, well, I don't like the color of this tooth next to this one. And this may be a simple fix rather than a full crown. I have no vested interest in the restorative therapy, so I'm pretty objective about what I can recommend.
Yeah, and I think that is peace of mind for the person who may need help with a missing tooth, because you're just a source of information essentially, rather than feeling like I'm trying to be sold a procedure or something that I don't necessarily need. So we've gone over a lot of these different options. How much of it is dependent on the preference of the patient, and how much of it is dependent on the current state of their mouth or the area of the missing tooth?
Yeah, it's a good question, because sometimes I always tell patients to get a second opinion. If they come to me and they say, this is my treatment plan, they already have a treatment plan. I don't know if I want to do this. Like I say, it's beauty's in the eye of the beholder. What are your goals? And then, is this practical for you? And sometimes an operator may have a strong preference for certain restorative treatment in their wheelhouse of options. I call it my golf bag of treatment options. They have their own special golf bag of options for restorative therapy, and it may not be quite what that patient's looking for, although it looks good and sounds good, do they have other options? It's expensive to do, say you're a dentalist and say, I just want teeth that don't come out at night. Well, there are places that you can go, and we do them too, where you can have implants, all implant born. They call them all on fours. Sometimes it's more than four. It has to be like six, particularly if you got a large individual and a big mouth where the implants are holding this fixed bridging and it doesn't come out. And so you got to have the strength and foundation for it to go into. Well, that's a pretty expensive treatment plan. And, do you have options other than that form of therapy? Can you do an overdenture? With teeth being present, do those teeth need to come out and go into a denture, overdenture, or all on four concept? It's sometimes the path of least resistance. That teeth has some decay, you got periodontal disease, just take it out and do implants. Well, not necessarily, and periodontal disease is an ongoing thing. If you can get it under control, there are teeth that can be saved that some people are condemning, particularly if a patient is not, are you having pain? No. Can you eat okay? Yeah. And they may have some mobility, or they may have some inflammation that looks like, they're not going to keep those teeth. And we can treat that and then make a decision, do these teeth really need to come out? It's giving the patients options. It's always better to try to keep your natural tooth if you can. But it's predicated upon medical history. Why did they lose the teeth to begin with? Are they susceptible to decay? It's not just a simple, yes, take this tooth out and we're going to do this. There's a reason why they're having a problem. Trying to understand that and help the patient understand that, because they may come in and say, I want this all on four fixed. Well, why did you lose the teeth to begin with? Are there other options so that 20 years from now, the money that you put into this is going to still be there? That's what I'm looking at. Short term, great. It's interesting that when you are in my profession, if you have decay, you fix it. You're done. You have a crown, you fix it. You're done. The foundation's a different story, and it's an ongoing issue, and it's a never-ending battle between your ability to remove to grow bacteria, remove it, and how you react to what's left over. So whatever's on the top, be it crowns, fillings, bridges, implants, that individual needs to understand that it may look pretty, but you got to take care of it, because if you don't, you're going to lose it. And sometimes there are well-meaning individuals out there. They say patient comes in, they want to look beautiful. They want that Hollywood smile. Is that really for them? And it's always good. Again, get a second opinion.
Yeah, and you just mentioned taking care of it before you lose it. In that respect, once we explore these options, if we have a missing tooth, there's still maintenance involved after that. We still have to do our part, right?
Exactly. I mean, I've had some people come in and, they've had an implant done somewhere else, and they'll come back in and say, well, you got inflammation around that. And so, you got to do this is how you floss it. Well, I didn't know you had to floss it. That was titanium. I said, oh, yeah. Ignore it. Floss the things you want to keep. The motto is floss the teeth you want to keep. Now we got floss the teeth and the implants you want to keep.
Floss the things you want to keep. I like that. That you should make a sign out of that and have it up in your office if you don't already. Well, you always leave us, Dr. Singletary, with an action step that we can take. And what would that be for those who may know someone or may be missing a tooth on their own?
Well, first of all, assess what your desires are and get a recommendation. And then it's always good to get a second opinion. It just behooves you to get as much information as you can. Once you got a treatment plan, you're not going to hurt anybody's feelings to get a second opinion. And beauty's in the eye of the beholder. It's what you want. It's not necessarily what the operator wants. You decide what you want and then go from there. But then get a second opinion.
That's great advice, and a second opinion is always in your best interest. Well, that will do it for this episode. Thank you so much for listening. On behalf of Dr. Macon Singletary, I'm Jason Kong. You've been listening to the Gum Guru Podcast.
If you want to know more about whether you're a good candidate for dental implants and other options to replace missing teeth, then check out Dr. Singletary's website at northraleighperio.com. If you have other questions you'd like answered on the Gum Guru podcast, send them to contact@northraleighperio.com.